Bladder incontinence is often perceived as a normal part of aging, but it doesn't have to be. A growing body of research is establishing successful clinical protocols for this treatable medical condition, including non-invasive bladder ultrasound. The direct supply attendant bladder scanner is an affordable, user-friendly unit that can help caregivers address some of the most common issues associated with urinary incontinence. And it's fully supported with educational resources, best practices, and how-to videos. We've brought Liz Jensen and Dr. Christine Bradway to share their expertise on this widespread but undertreated issue.
Hi, I'm Liz Jensen. For over 20 years, I've been a nurse executive and educator, and I am currently the clinical director at Direct Supply. I'm joined today by Dr. Christine Bradway, Associate Professor of Gerontological Nursing at the University of Pennsylvania School of Nursing. We're here today to discuss urinary incontinence, a problem that affects more than half of the residents in long-term care.
Thanks for inviting me to join you. I've worked with older adults with incontinence for 25 years, and I'm excited to share some of the evaluation and management strategies that have been effective in my practice.
Chris, in your opinion, what is the significance of urinary incontinence in older adults?
Incontinence is not a normal part of aging, but all too often it's left untreated, causing major issues for older adults. UI has been associated with increasing the risk for falls and injuries, skin impairments, withdrawal from activities, and depression. And for the person experiencing urinary incontinence, activities or events that were once enjoyable may become occasions of anxiety, embarrassment, and worry.
On top of that, incontinence care can be very costly.
Yes, cost is another key issue. In the U.S., the annual cost of managing urinary incontinence in long-term care is estimated to be $5.5 billion. Catheter-associated urinary tract infections alone cost an estimated $340 to $370 million annually and are one of the most common types of healthcare-acquired infections. The use of incontinence products, although helpful, should not be considered a first-line management strategy.
That's right, and incontinence that cannot be managed by the resident or family is one of the top 2 reasons a person may need to move into long-term care.
Within long-term care, there are federal regulations to guide how incontinence is addressed. We know from the MDS 3.0 data that 60% or more of residents in long-term care facilities are incontinent, and of those, up to 86% may require assistance with toileting. Yet only 15% of those that require assistance are actually coded on the MDS as currently in a bladder or bowel training program. So even within long-term care, this remains an area with room for improvement.
Chris, how well prepared do you feel most caregivers are to address the issues of incontinence?
One might think that with the prevalence of this issue, nurses, physicians, and other caregivers would be well prepared to address the issue of incontinence. Unfortunately, delivering evidence-based care is complicated by many factors, including staffing, cost of care, staff knowledge of best practices, access to ongoing education, accessibility of equipment and supplies, and involvement by the primary care provider. I recently met with nurse researchers from the University of Southern Indiana. They have found that once nurses and CNAs understood that UI was not normal and could be effectively managed, they were more likely to promote continence and UI treatment programs.
In the past 15 years, the body of research on urinary incontinence has grown steadily. Clinical leaders can now look to evidence-based practices to define an effective assessment, treatment, and management program for residents with urinary incontinence.
But implementation of practices often remains a challenge.
A current project addresses the question of how to successfully translate best practices into day-to-day clinical practice. Findings strongly suggest that the most success occurs when caregivers implement a bundle of practices together. Their recommended approach includes a protocol for discontinuing use of indwelling urinary catheters, reminders and prompts for removing catheters, alternatives to urinary catheterization, protocols for inserting and maintaining catheters, and implementation of portable bladder ultrasound monitoring.
Obtaining a post-void residual using a bladder scanner is an important addition to clinical patient care. I've been utilizing bladder ultrasound technology for at least 20 years, and I've had the opportunity to trial the new direct supply attendant bladder scanner in my practice. I've found the attendant bladder scanner to be accurate, dependable, and very easy to use. In my opinion, the bladder scanner would be a useful addition to any long-term care community.
Chris, thank you so much for your insights and contributions. You've really helped shape our product and our caregiver resources.
We know you care about your residents' health and quality of life. With the direct supply attendant bladder scanner, you now have an affordable option to adopt a recommended best practice for those residents who struggle with incontinence. If you want to learn more about the attendant bladder scanner, you can view our other videos or visit us at directsupply.com.